Good morning, everybody, and happy to be here. I'll try to keep this very succinct. And I know that we have a couple of representatives from our Children, Youth, and Families team here that will be able to also address questions related to the child care ratios, both in terms of the parameters of the program as it stands, as well as any pertinent updates. And I'll try to provide some insights about the waiver as well. Just briefly, in terms of where we stand related to COVID cases, this morning it was reported that we have 2,149 cases across the state, which represents the second highest daily total throughout the pandemic. The highest total throughout the pandemic was on Saturday when we had over 2,300 cases. The average positivity for the state has increased to 6.9%, and the average case rate for the entire state is now 29 cases per 100,000 residents. All 24 jurisdictions have case rates now above 10 cases per 100,000. 18 jurisdictions have case rates that are above 20 cases per 100,000, and 6 jurisdictions have case rates above 30 cases per 100,000, including Allegheny County, which actually has a case rate this morning of an average of 110.6 cases per 100,000 based upon the updates. Now, as it relates specifically to Montgomery County, today we have a daily total of 361 cases reported. Our test positivity is at 5.4%, and our cases are 22.6 per 100,000. Of note with the test positivity, one of the things that is actually helping with that measure, and you don't see it increase as much as the others, is the fact that our testing apparatus is very strong here in the county, and we're testing lots of people. We're now averaging, just from the county-sponsored sites, anywhere between 1,500 and 1,800 tests a day. And as we previously talked about, as a collective county, we have reached or close to suppressive level testing per the different public health algorithms. When we talk about our R naught value, our R naught value has, as of this morning, is 1.36, I believe. And in addition to that, a couple of the other numbers that had not increased as much in our last conversation relates to hospitalization. So when we look at hospitalizations, hospitalization utilization is increasing, in particular looking at acute bed usage, ICU bed usage, and emergency room visits for those who have COVID-like illnesses showing up to our emergency rooms. Additionally, when we look at our overall numbers for the county, 27 of our 45 zip codes have case rates greater than 20 cases per 100,000. So I put that out there because I want folks at home to understand the seriousness of where we stand. We continue to get emails, and it's the privilege of everybody, but we continue to get emails about nuances about the different restrictions that are put into place. I cannot emphasize enough the seriousness of where we stand in terms of the numbers and in terms of the potential actions that may need to be taken to curb the continued and sustained increase in cases that we're seeing right now. And to that end, we are continuing to look at our contact tracing data to determine the potential next steps that we may have to take, given the way the numbers are trending right now. We will get an updated report on contact tracing on tomorrow from the state. We will look into that further. We, in terms of a couple of other updates and key areas related to vaccines, so the state has convened a commission of experts to look at that, including experts from industry, academics, and public health. As the chair of the State Immunization Advisory Committee, I am a member of that committee. We had our first meeting on yesterday. We are getting more specifics from the federal government as we talk through how we will disseminate the vaccine throughout our community. And something that I want to also emphasize is that this process is heavily regimented. There will be 4 phases of priority groups. And the way this will be disseminated is it will be heavily regimented and in concert with the state. There will be lots of guidelines and expectations that we have to follow as designated by the federal government and the state that will determine how we can roll this out. Now, at least in the early stages of this, The process will be very much defined by public health teams and distribution processes. There will not be opportunities to dole out, to give out vaccines and say, here's to this group, here's to that group, at least in the early stages. There are partnerships being formed with pharmacies to be able to provide vaccine coverage for our assisted living facilities and nursing homes, at least for staff. We can say all of our nursing homes and assisted living facilities in Montgomery County have partnered with and signed up with pharmacies to provide that support. And again, we're continuing to work with the state and our regional partners on larger distribution strategies. Now, we are working on pulling together different task force for different areas and components of the distribution process. And one of the key areas where we will need the community's support the most at different organizations is around education and outreach to, one, dispel rumors and myths about vaccines in general, but to make sure that folks are educated and understand the importance of why these vaccines are needed and necessary. And there will be opportunities to partner with groups as well to be able to utilize those resources, at least in the early stages, to get the vaccine out. There are 2 candidates so far. They have not made it across the finish line. I want to be very clear about that, that have shown promise. A vaccine candidate from Pfizer and a vaccine candidate from Moderna Pharmaceuticals. They are different in their storage requirements and how they will be rolled out. But each of them, at this point, what we know, will require 2 doses approximately 1 month apart. And the anticipation is that we will potentially get some vaccines, at least for the first priority group, to start disseminating that potentially as early as late December around the winter holidays. So I will stop there, but just wanted to give some broader updates. We'll turn the floor over to Dr. Stoddard. Happy to answer any questions you all may have. Thank you.
Thank you. Dr. Stoddard.
Good morning. A few things I want to touch on today. So we're going to work on a release related to this, but we did post on the county's website the guidance around ventilation and filtration. I want to say a few things about that publicly so that everyone's clear. Number one, not all buildings, in fact, most buildings will not be able to meet all of these guidelines, and they're simply guidance. Depending on the design, age, and layout of a HVAC system, one or more of these may be meetable without any substantial increase in or any capital costs, essentially, for replacing those systems. We're not interested in having people go out and do wholesale changes of their HVAC systems. Number one, it would be incredibly expensive to do so. Number two, you likely could not get the work done in a timely enough fashion. And number three, we're concerned about making any long-term changes that would substantially change systems to make them less energy efficient, given the threat of climate change that we're also having to respond to. We're going to do some more media to get those out there more publicly for all of our businesses to see. And in addition, we actually started last week, had a webinar with our business community, Dr. Gales and I did on Friday. I will be attending the next one on this Friday, and we will actually be having some experts come in from outside the county to talk about the ventilation and filtration guidelines and how businesses can aim to improve their ventilation and filtration at low or no cost. We're also working on a houses of worship webinar. We're tentatively planning that for next week as well. Obviously, having made changes to our houses of worship guidelines with the past executive order, as we did with several other categories. In addition, Dr. Gales referred to the Wednesday contact tracing report. And as we've been tracking the contact tracing, we have seen an uptick in the contribution of people participating in religious services and attending religious facilities in the overall contact tracing numbers that have been observed. I think that's something that we want to be able to talk to the faith community about, and how their role in keeping the virus in check is incredibly important. So we're actually actively working on that. One of the other big areas of emphasis in our enforcement side, and we are going to be pulling in some additional inspectors from various agencies within county government to assist the surge in enforcement, is number one, we're going to have a meeting with our construction site managers. I'm already coordinating with Department of Permitting Services to coordinate a meeting with our construction site managers, because we know that those frontline workers are have been viewed as essential from the beginning of the event, but we also know that they are, by being essential, they're being put at adverse risk. We want to make sure that we're working with construction companies to be making those work sites as safe as possible. In addition, and we've talked about this a bit before, an emphasis around the big box stores is going to be coming as well in enforcement and in education, because we do know that while grocery stores and some other major retailers are important cogs in keeping the community running, they bear a significant responsibility in making sure that their locations are safe and accessible for the public as well. We have had to do some interventions to keep the numbers in check. Obviously, those are large buildings and can typically have a fair number of people in them, but there is a limit to that as well, and we want to make sure that that is enforced as well. This past weekend in our enforcement, we only had to issue one warning. We visited, about 25 different locations across the county, including the 3 streeteries, and we made, some observations in visiting those locations, but generally things were being done at a relatively safe level. And then our next community recovery advisory group meeting is actually on, it's tomorrow, Wednesday night, the 18th. We're going to talk about some of the innovations that we've undertaken during COVID-19 in the way county government delivers services, and talk to our community representatives about those things and what are the things they'd like to see us innovate in. So, those are all the things I have to address. I will note one thing, and this came up for those who were on our morning call this morning. Joni Menick from HHS, who is part of the contact tracing team, did share a few key things that they are seeing in the surge in contact tracing. And I believe it was yesterday, they had 61 investigations that involve either child care facilities or private schools. And so just as a reminder that is an ongoing issue that we face, and frankly has been, it's not disproportionately larger than the other things, but it is a surge that we are seeing, just as we are seeing across the board in cases and other things like that. So just wanted to share that, and obviously have to take questions.
Thank you. I did want you, whoever is going to bring it up, please, but about the waiver rejection for childcare, who is going to discuss that and what our next steps are and what we can be doing?
Sure. So I actually was writing down a note to realize I forgot to address that. So the waiver that the council president is referring to is that for those folks at home, is the state put in capacity limits for child care facilities throughout the pandemic. They were allowed to continue to operate, but due to different levels of community transmission, the state put in different requirements and capacity limits for operation. And we moved along with the state, and we were actually in phase 2 through most of the pandemic. And phase 2 is operating at 50% capacity. Now, several weeks ago, the state made a decision to relax the capacity requirements and go back to full capacity. We at that time did not support doing that due to the levels of community transmission at that time, and as a result, during that time, we made the recommendation to not move past phase 2 to go back to the original capacity. The state put in a requirement that at the end of the month, effective at the end of the month, there are certain ratios, teacher to student ratios, that the child care facilities had to follow. That is easier to absorb when you have a higher number of students, not students, but children coming into your facility. And then if you have a smaller number of folks. So if you only can, if you're operating at 50% capacity and you increase the number of staff that have to be there, that decreases the number of students effectively who can come in and use those resources. Now, since then, we filed a waiver request from MSDE as a jurisdiction, requesting that because we, as the governor has laid out, each jurisdiction has the opportunity to make comments and make those decisions, and requested a waiver from that requirement. We were denied that request by MSDE and received that on late Friday, I believe. And since then, since that determination related to capacity was made, we have seen what the case numbers have looked like in the state. Our local numbers have doubled and in some days tripled from where we were when that determination was made. And the state numbers have increased not exponentially, but have increased significantly as well. So as a result, I know that there is, the county executive is working on a letter in response to that, again, to request consideration for that waiver. In a separate action, we, in our health officers' conversations with MDH, I pointedly asked on yesterday, will the state consider changing those capacity limits due to the significant increase in cases? Which is why they put the capacity limits in place in the first place, as a response to community transmission levels. So that's where we currently stand. I know we have representatives from the group as well, from CYF, the team that works with the child care facilities, and we will continue to have conversations to look at some alternatives. But I want to be very clear. Again, the recommendation to stay at phase 2 was informed by high levels of community transmission. And when that determination was made, the numbers have gotten even more significantly worse. And to Dr. Stoddard's point, we have had active investigations in a number of child care facilities. I do recognize that there were some facilities who testified approximately a week ago who have not had instances in their places. That has not been the universal experience across the board. And the reason why we're concerned about it is higher levels of community transmission, much like we put in restrictions to businesses, schools, and other places, could potentially lead to increased cases within those child care settings, not just for children, but also for staff, and lead to further closures of those facilities.
So just so I understand, we're asking again for a waiver. We're asking for a reconsideration of the waiver that was rejected. And then if that reconsideration is not given, then Ms. Barnes or whoever else is on, I can't see everybody on the call, but who's ever else on the call, what would be our next step? I mean, could really be a crisis for families in Montgomery County. And so we need to, and I don't know if you can comment on everything that you're attempting to do, but we need to figure out what our next steps could be if we don't receive the waiver that candidly we should be receiving. Ms. Barnes or whoever else is on the call, please. Ms. Andrews, go ahead, please.
This is Joanne Barnes, Chief of Children, Youth, and Family Services. I would like to turn it over to Barbara Andrews. Dr. Andrews is the head of Early Childhood Services, and she and her staff are working closely with providers and clearly understand the impact that this has on a typical provider. If the state does not approve the waiver, I think at this point, we'll have to put our heads together and see what other remedy we can come up with within the guidelines of the law that the state has provided. What's confusing to us is that the state has given us, through the public health officer, the ability to do some things locally based on what's happening in our community. And then at the same time that we ask for requests to help fill the needs based on the statistics in our community, then they deny that. So it does put us in a bit of a quandary. Barbara Andrews, if you're there, could you talk a little bit about what that means to a typical provider? I know we know of some instances where it is going to have an immediate negative impact.
Right. So this is Barbara Andrews with Early Childhood Services. The one thing, sorry, Dr. Gales, I need to correct one thing. They were never at 50% capacity. You know, we had that whole issue before. They're at 15 in a room is phase 2, or 15 in a family child care home. And that's 15 people, not 15 children. So you have to factor in the teachers. And in family child care, it includes the number of people they have in their family who are in the home. So it limits their enrollment. And the issue with the waiver was they did deny it. And what we don't completely understand is that in phase 1 and phase 2, they were able to reduce the ratios. We're still in phase 2. It's no different than what we were doing before. And yet they're requiring across the state is requiring that across the state by the end of November that everyone go back to the normal ratios, which would be in place if you had normal enrollment. The state has gone to normal enrollment as a whole. And so that's where we are. In terms of child care programs, we know a couple of different things. There are programs that have the infrastructure to have that additional teacher in the classroom, but that's not a lot of programs. Some have had additional teachers in the classroom anyway, because that's the way they operate their program. It is very difficult for family child care. You know, we're talking about people who may only have a couple of children in care. In terms of other programs, there are some that are choosing to say to a parent, I can't have your children here because I can't hire another teacher for this ratio requirement if I can't go back to full enrollment. So that's where the situation sits. Another letter, the second letter, is going to the state this afternoon. It's a very strongly worded letter. And then beyond that, the county executive has to decide what he wants to do.
Thank you. We are all very, very concerned about this, and we know you are as well. And so we stand ready to work with you in any way that we can to help in any way that we can. And with that, I'm going to turn to my colleagues. We're going to go to the 5-minute rule. So, Councilmember Navarro, you are the first council member, please.
Thank you so much. A lot of important information. So definitely, I'm trying to figure out how to triage my comments or questions. I continue to go back to this notion of communication. Obviously, now we've entered a different stage. And people are trying to figure out, of course, what that means for us locally, but also the issue of vaccines are really important. Dr. Gales, thank you for mentioning the fact that the state will be providing that guidance. I know DC has its own task force. I assume it's because they're not a state, so they do it locally. And it was something that I know at COG that has been discussed. I'm wondering, you know, when I look at the portal, it's very content rich. And I do wonder if it's possible to somehow redesign the portal so that if a resident wants to click on there, we have the numbers, the number of cases, et cetera. We are obviously in this fluid situation where we may have to make some changes, et cetera. I'm wondering if it's possible to not only have the case numbers and all, but to have some type of way to signal why it is that at this point in time, we are monitoring and really truly entering a second wave. And as things begin to change vis-a-vis an executive order or anything like that, that can be sort of front and center versus making it so content rich. I mean, I know we do Twitter, we do all these things, but I still feel that the issue of communication is going to be so central for us as now we're, you know, trying to navigate this next wave. Has there been any thought about taking another fresh look at the portal with that, you know, sort of angle, that kind of being able to say to folks, hey, we've entered a new phase here. This is different now. It's, you know, it's a little bit somber, of course, but we have got to understand that this is where we are. Has there been any conversation about that? Because I think it would make it a little easier for everyone to get everybody on that sort of mindset.
Yes, I know the comms team has been taking the feedback that you all have provided, and in additional conversations. I know that the PIO met with Councilmember Glass last week to talk through some strategies how to distill the information in more palatable, digestible ways. And I think it's an ongoing task. So I don't handle that piece, but I know that they're working through that. And I know that, in fact, they're trying to, put out more simple messages just to say, here are the numbers, here's what this looks like, in many different ways. So I would say, if you all have, continued suggestions or recommendations, to continue to send those to the team and think through. I know that there have been discussions about, for example, related to messaging around vaccines. So at the state level, thinking about how we can identify key stakeholders within different communities who can be vaccine champions, if you will, to communicate that effectively. From a cultural perspective, I have had conversations with my family members like, do we need to get that? Is that saying, vaccines are worked for us, historically. And so having to have some of those informal conversations, to break through some of those very well founded concerns, to be able to encourage people to get it. So I say all that to say that I think that there is multiple opportunities to engage a broader audience to be able to help to do that work. And I know that the comms team has been trying some different strategies to think about how to do that best.
We just add that one thing about communications that we know is that different audiences have different expectations for information. And some of our audience want a lot more information and more detail. Some of our audiences want the quick and dirty, what's happening and how. And obviously the cultural and other diversity that we have in the county requires different messaging in there too. I will note that the LHI initiative and the AHP initiative has specific communication strategies tied to those that you all are very, very well aware of. I see Dr. Corral, he may want to comment on that as well. But we've been really trying to tailor our messaging, reflecting that one message that the county puts out will be heard and received by one set of population, whereas a different messages will be better received for a different population. I think we've been really trying to diversify rather than go down if we make a change to the dashboard, we're trying to be cognizant of the fact that if we make one change to the dashboard, it may make it better received for one audience, but less well received for another audience. So we're really struggling with how do you have a single dashboard that speaks well to all of the different audiences. And I don't know if it's
I just wanted to just share that, when I, council member, look at the dashboard, it's busy, right? And that may be okay when we're sort of in a plateau, but I'm concerned about the fact that we have entered a total new wave. And so if there's a landing page of sorts that kind of distills that information so that it signals to me, whoa, we've entered a new stage now, this is where we are. The rest of the content-rich information can still be there as an archive so that if I want more, I can go search that. But I think there needs to be sort of a landing page that signals to me and to every resident that we've entered a new stage, and this is why, and this is what we're trying to address with that. That would be super important. The tailoring of the messaging to our different communities is obviously something that folks are doing really well. But I think we need to do this because, as Dr. Gales was saying, as we enter into the vaccination, possibility and stage, et cetera, there is a lot of mistrust in many communities. And so I think preparing the stage and the mindset, it's going to be important. Given the fact that we talk about fatigue, given the fact that folks, just feel like it's just so overwhelming, all the information that you're getting and the signals, et cetera. If we could do that, just make it a little simpler in the landing page with that information up front, basically signaling this is different now. And then we do the same with our, LHI, the African American Health Program, which again, they're doing extraordinary work. We could tailor the message as well so that these communities also understand that, hey, everyone, this is different. This is different. It's okay. We can get through this. And I've said this, publicly, right, when I've been interviewed. We can do this because our residents have been amazing. But there needs to be a recognition and an ownership that this is a new day. And therefore, we have to continue to do what we're doing, but also be even more mindful because we have the flu season upon us. This winter, we're going to be indoors. That combination, it's really troublesome, and everybody needs to kind of understand that. So that's, that I just offer that. I mean, I'm not a super expert on communications, I can just tell you that, again, as a council member, when I open it, I can get to where I want, but I put myself in the shoes of a mom that's trying to navigate all these things at once, and it's not as user friendly, or it doesn't give me that signal that I think I need, or everybody else I think needs in order to, get everyone on the same page. But Councilmember Glass is an expert on this stuff, so he can help.
So, Councilmember, I just wanted to, before you jump in, I wanted to just weigh in on this a little bit, if I could, for a second. And that's just to say that a couple of things. It'll be interesting to go back and look at the evolution of the pages, of our landing pages over the last 9 months, to see how to see and recognize that it is a continuous process of evolution and changing. One of the things, just so you know, that is happening now is that we are working with MC311 to try to identify and simplify our webpage for referrals for resources. So we'll roll this conversation into that conversation to see what makes sense in terms of ways to simplify, balanced against the number of clicks that people are willing to go through to get information that they need. So there's a balancing between putting sufficient information there and keeping it clean, so that people don't get overwhelmed, but also can very quickly see what they need and find what they need. So we will add that to the conversation that we're having with 311 about revising our process with them.
Thank you very much, Councilmember.
Last thing, Councilmember, I'm sorry, Councilmember, just real quick.
Okay.
The state of Florida has not done a very good job at dealing with COVID, but the Miami-Dade website, their portal, you should take a look at that because it is much simpler and it is much more user-friendly. So I'll offer that as an example, just very quickly. Thank you.
Thank you, Councilmember Jawando.
Thank you, Mr. President. I'll use 10 seconds on Councilmember Navarro's point. I think if you had like a green, red, yellow, red, or some sort of indicator that said we're like in a really difficult zone and then all the information, I think that is a good point and might be an easy way to keep it and add something. I want to apologize to Ms. Barnes and Dr. Andrews. I am furious that the state superintendent and Governor Hogan have played politics with something that we were already approved to do. You were very kind to say it doesn't make sense. I'll go further and say it's just absolutely ridiculous. The idea that we couldn't have the same ratios because we chose to have a safer option and keep our families and student and childcare providers safe, and now you're punitively punishing us with not approving the waiver for something we were already doing is absolutely ridiculous. So I just want to be very clear that I know the governor is going to speak at 2 p.m. today. He needs to direct and speak with Dr. Salmon, and they need to reverse that. That makes no sense. It makes your job difficult, and it's not safe for our children and families. I'm very disappointed. I also wanted to ask Dr. Gales, did you say that we've had some of the highest case counts since the pandemic began statewide and locally? Could you just repeat that if that's the case?
So the 3 of the top 5 daily reported cases have been in the last week. Both over the weekend for the state at 2,300, 2,100 today, and I think there was also a day earlier this week of 1,800. And on a local level, the 364 that we have today, I believe, is the 3rd highest total that we have had. And we did have another day earlier this week or over the weekend where we had over 330 cases as well.
I appreciate that. I think just people need to understand the severity of where we're in. As people congregate inside, as we're at the holidays, we're at a critical moment. But we also are at a moment that's different from back when we had those high case rates where we have potential hope of a vaccine on the horizon. And I yesterday and I want to get your thoughts on this to the extent that you're willing to comment. I yesterday called on the governor to issue a stay-at-home order statewide. And I know I think other colleagues have mentioned that as well. I think he has to do that for 4 weeks at least. Let's get through the holidays and then also give money to our businesses, release that remaining funding. At this point, do you think a stay-at-home order statewide would help? Additionally, mask order or any other things, curious what you think, would help limit the spread at this critical time as we head into the holidays with some of the highest case rates that we've had throughout the entire pandemic?
Well, I think it's one thing to observe too is what's different about the case numbers we're seeing right now is we're seeing the highest numbers that we've seen through the pandemic and we're open. When we were seeing comparable levels like this back in the spring, everything was closed down. And so we're having to deal with that and balance the high numbers in a setting where we still have a lot of things open and lots of potential contact. I think from an epidemiologic standpoint, a shutdown of some time period could have significant benefit in terms of limiting exposure to other individuals and potentially minimizing and mitigating transmission as much as possible. So I do think there would be significant value and benefit to that. At this point, as the numbers continue to creep up, we're putting ourselves in a very difficult position without taking potential further restrictions if we want to get the number down. Now, as you mentioned, there is a light at the end of the tunnel, if you will. We use this analogy in our business call on Friday that it's, if you can think of a tennis match, best 3 out of 5, we're at the beginning of the 5th set. You're tired, you're exhausted, you're cramping, you're physically just, you don't have it left, but you've got to get through it if you want to win it. And so we do see promise of vaccines coming within the next 6 weeks, potentially as early as 6 weeks or so for those most vulnerable in our population. But there's a lot of time and there's lots that can happen between now and then to get there. So we've got to continue those public health practices. And you know, we're going to have some further restrictions really ultimately to curb the numbers where we are.
Well, I appreciate that. And I'm thank you for being honest and candid with your opinion. I think we are willing, we have shown we're willing to do what we need to do here in the county. But as has been said, what at this point with the case counts statewide, it would be more effective to have a statewide order. And we have that light at the end of the tunnel. And we can tell our folks confidently, hey, buckle down. This won't be forever. We know what we need to do. So I just really hope the governor says that today. I appreciate all the work that you all are doing. And I saw that the letter from the county executive came on the child care issue. So we'll keep pushing on that as well. Thank you, Mr. President.
Thank you.
Councilmember Jordan, I'd like to add one comment to the question of restrictions. If you want a really clear example of this, look at what's happened in France. On October 29th, they instituted a national lockdown in France because their cases were skyrocketing, and their cases continued to go up until approximately 8 days after that lockdown went into effect, which is about the time it would take to see a lockdown taking effect, and they have since fallen off a cliff. And so the lockdowns or stay-at-home orders or closures are terrible, terrible things to have to implement. There is no question about them. They hurt businesses, they hurt the economy significantly, but they do work from a public health perspective. You can see it time and time again. It's these half measures that often do they do a lot of harm, but they often, don't get as quick a public health benefit at the same time. So it's sort of like, how much, what balance of hurting the business community versus hurting people are you comfortable with? And it's, you hurt businesses a lot, but you help people a lot. And that's the choice that is being faced. But doing nothing and letting people get hurt obviously is not a great solution.
Thank you.
Thank you, Councilmember Reamer.
Thank you. Let's just continue with that thread. First of all, I also called on Saturday, I think, for Maryland, DC, and Virginia to institute a shutdown, a stay-at-home order. As you were just saying, we are now in the worst scenario where we have substantial shutdowns, but it's not really reducing the spread of the virus sufficiently. And so businesses are hurt, people get sick, and we're heading towards a cataclysm, it seems to me, with the health system, in a few weeks. If we could act together as a region, we could have the most effect in the shortest duration. If Maryland, Virginia, and DC could act together with a stay-at-home order, it could be a shorter order. We could, as you said, put in a cliff on the transmission of the virus, and then we can resume. But if we just keep clamping down on it incrementally, we're going to spread the pain without getting a lot of benefit from a health perspective. What we're doing now doesn't seem to be working, and we have cases that are through the roof. I wanted to quickly say, I really would like to see a written strategy, like we had a written testing strategy, a written strategy on the vaccinations. I think Councilmember Navarro was making a lot of really important points about vaccine confidence. Let's not sugarcoat it. Donald Trump has reduced confidence in the vaccine. People don't trust it as much as they should. They don't trust the science as much as they should because people are afraid that it has been politicized, that there are decisions that have been made along the way which have not been made, but that are not in the best interest of health. And so we have to have a concerted effort to get deep into our communities where that confidence and that trust is diminished. And we need a plan to do that. So I'm glad you're working on the communication side. I know you're very aware of this. So really, it's calling on the rest of the county government to come forward with a strategy that will achieve the goal. So again, I really would like to see a written strategy, both around distributions, like how the first 25,000 doses will be distributed, but then bigger picture on how to combat vaccine confidence and ensure that people are ready to take it where they most need to take it. I'd like to just go back to the case rate. You know, another day of more than 300 cases is alarming. Can you talk to us, Dr. Gales, Dr. Stoddard, where will we be in 2 or 3 weeks with hospitalizations if this is the new plateau of case rates, if we're staying at this rate? You know, right now it sounds like hospitalizations are not yet at a crisis level, if I'm interpreting the data correctly, but that's, you know, there's a lag there. So talk to us about what you might foresee.
Well, we are fortunate to be a part of throughout the state. We get estimates from a number of different places, and Johns Hopkins actually does a weekly hospital projection model based upon the different parameters and restrictions that are put into place. And the most recent model that we received on Friday, they do optimistic, moderate, slightly less moderate, and then catastrophic scenarios based upon the level of restrictions. And their current outlook suggests that the growth of hospitalizations, that we are on a path right now similar in magnitude to the growth of hospitalizations that we experienced in March and April. And efforts to dampen transmission will likely take weeks to take effect, but should be implemented immediately to reduce the likelihood of a catastrophic outcome. And I've shared these slides. I just sent it to you all, actually anticipating this question. And you can look at the different charts to show the impact of different levels of restrictions on activities and how, just for example, limiting an infected person's contacts by 50% could decrease the risk of a catastrophic hospital overload by approximately 25 to 30%. And so I would encourage you to take a look at those models. These are the types of things that we look at as well to help inform what we put forward in terms of recommending guidance to adhere to. And so the other thing I wanted to mention quickly is related to the vaccine distribution plan. There is a plan. So let me just reiterate that this is a heavily concerted effort that goes into effect working with the state and the federal level. And so lots of the steps, at least in the early phases, getting the vaccines to those folks who are in the priority group 1 will be done heavily regimented, working with the state and the federal government. And so those strategies will be in part consultation with them. And the state has convened an expert committee again that I'm working on and serving on to iron out those details, as well as the local team has been working on how to implement that strategy on a local level. So a lot of the activities and actions that we will put into place here will be informed by the specifics we get from the state. That will then again be informed by once we get more information about the specific vaccine candidates that we'll be utilizing.
Thank you. Councilmember Albornoz.
Thank you, Mr. President. I'm going to try to stick to 5 minutes, but I've got several categories of questions. I'll start with the waiver, and I echo Councilmember Jawando's frustration and deep disappointment in the governor's decision not to grant the waiver. But I'm also not surprised that he didn't grant the waiver because that seems to have been the track record, and our relationship with the governor's office feels like it's regressed since the beginning of the pandemic, and communication has been an ongoing challenge, as we know. And so at our briefing last Tuesday, when we discussed this matter, it seemed clear that the executive branch, and I appreciate and respect your understanding of the deep challenges that our childcare providers face on this. I know you're feeling the same pain they are, but there was a discussion then about a plan B, but I'm not hearing like we have developed one. I just want to confirm, and Dr. Andrews, I have such respect for you. I've known your work for a long time, and so I have to hope and assume that we've at least laid out some options for the county executive to consider in the event that this second letter, as sternly worded as it may be, is probably not going to succeed. Let's hope it does, but I'm not confident that it will. And so can you confirm that we have developed options for the county executive to consider?
Well, let me first mention the letter has now been sent to all of you and to your staff. It was CC'd not just to Dr. Salmon and to several legislators. And the county executive, as of yesterday anyway, had intended on making it public. So I think the next step is pressure. And it depends on how the county executive's office and the intergovernmental relations wants to go with that. I don't think we can, I agree with you, I don't think we can change the governor's mind through this, but that's our first attempt, is to take this approach. And we have a lot of legislators who have been pushing for maybe not this specific issue. I don't know if they're engaged in this specific issue of the ratios, but they have been pushing for things related to child care ever since the beginning of the pandemic.
Well, but I'm still not hearing a plan B, and that is really disconcerting because it's November 17th. This expires in less than 2 weeks. The practical reality is that 4 out of 14 families in classrooms, multiply that by classrooms, multiply that by childcare providers, right now are anxiously wondering what the next step is with Thanksgiving in between. And so if we don't give those families a sufficient amount of lead time and are just hoping that this waiver is granted, then that's not a plan. And I understand that the numbers are stark and alarming on every conceivable level. And if the difficult decision is going to be made that we're holding the line at 10 families plus 2 additional staff, either we need to appropriate emergency reserve funds right now to help with the additional staff that childcare providers are going to need to be able to continue their services, or there are literally hundreds, if not thousands, of families who in 2 weeks are going to be left trying to find a different location for their child when capacity is already an issue. We heard repeatedly from childcare providers, families being impacted by this, people in tears, people just overwhelmed about the what this means and impacts families in a way that's very deep. And I know we all understand, but I think that we have to get a message out by tomorrow. And not wait. Let's hope that this letter and pressure works. But if it doesn't, then we need to get something out to families by no later than the middle of this week so that they can plan accordingly. And if there is a need for a special appropriation of some kind, just to support those childcare providers that are continuing to support these families, I think that's really important for us to get that word out. So I know that we're stuck between a rock and a hard place here. I'm not saying anything you all don't already know, but I think it's important that we reiterate those points.
Councilmember, this is Raymond Kroll. Just to say to you that we are aware of the urgency, and the team is always working to look at options around this. They have not put anything on the table for discussion in this meeting. Doesn't mean that we're not thinking through some possible options, including how are we using our current funding and funding streams and appropriations, and how might we shift some things around to address some of that. So it's a conversation with Joanne and Barbara and the team and with the second floor to come up with some options. This letter and our response is the first step in that process, and hopefully we'll get some sanity in this in the response rather than the what we're getting in the moment. But there will be something that we will have to put out and try to put out to families as soon as we possibly can.
Thank you, Dr. Crowley. I appreciate that. And I just needed to hear that. I knew that you guys were working on, different plans for a plan B, but I also think it's important for our residents to hear that as well as they, devise and plan. And I think that's relevant. The second, yes, go ahead.
I would feel pretty comfortable saying that plan B will not be getting rid of our public health protections. So just, I don't think we're going to acquiesce and just suddenly say we're going to full capacity because we can't. No, because the governor won't approve our ratios. So, I think we should be crystal clear about that. We're not going to sell short on the public health benefits. Just, that will mean we will have to provide some sort of assistance or other things to our childcare providers. But we've got to be able to just articulate that we're not going to reduce the protections in public health because of the ratio change.
I think I think that's kind of axiomatic. I mean, that we will not do that, and that I don't think that families would particularly feel comfortable sending their children to settings where the ratios are, where the number of students are twice as high as they have been, and the risk is therefore even greater.
Understood, and I don't disagree with any of that. And there's got to be something in between, you know, allowing those 4 families per classroom to continue to have the support that they need on so many different levels, but still adhere to the guidance. You know, I know you guys are going to come up with solutions. I look forward to hearing what they are, and messaging to families as soon as possible is really important here, as we've all acknowledged.
Thank you.
I probably just 2 more, Mr. President. I'll be quick. I'll try to be quick. The second question is, Dr. Stoddard, I've been reading reports. Boris Johnson, who already had the virus, is now quarantining because there's a concern he may have received it a second time. We're 9 months into this. From a medical perspective, are we seeing evidence that people who have contracted the virus are getting it again? There was this feeling that people, once you got it, you were never going to get it again. But it's looking like that's not the case. Can you confirm that and just state what we're seeing nationally on that?
Dr. Gales, I think you can start.
Sure. So the new recommendations and guidelines actually say that if you test positive for COVID-19, that you have some level of immunity for approximately 3 months. And for example, the recommendation was that if you test positive, they don't recommend that you get another test again for 90 days. So the suggestion is that your immunity period is approximately somewhere in the 3-month window, meaning that, yes, ideally you could potentially contract it again. There haven't been a ton of cases reported that I'm aware of, but there have been some cases reported in the literature where folks have become reinfected in the future.
Thank you. Our public needs to hear that. Once you've gotten it, that doesn't mean you aren't going to get it again. And then finally, with regards to hospital bed capacity, I know at the beginning of the pandemic, when Nexus Montgomery and the hospitals worked together, they took steps like eliminating elective procedures. They looked at communal rooms within hospitals that could be added with additional bed capacity. Are those steps being taken right now, Dr. Gales or Dr. Stoddard? I believe they are, but I think it's important for our public to hear that our hospitals are prepping and getting ready for this next wave if what is happening in other states happens here, which unfortunately looks likely.
Fortunately, again, we have a great, robust healthcare system and enterprise here with great leaders and clinicians providing service delivery. And so much to your mention, they have continued to utilize the playbook that was worked on so heavily and put together in the early stages of the pandemic. We met as recently as early last week to discuss that playbook and update that playbook. And the state has provided additional guidance since that conversation related to parameters around elective procedures and encouraging hospitals to not engage in those processes as much as possible to, one, be able to free up capacity for COVID-related illnesses or others. But the other thing I want to take this opportunity to encourage folks is, even when we're talking about reducing elective procedures and those kinds of things, if you are at home and you have a health condition, please go to the hospital. Do not wait and sit at home and, pass it by or wait for it to worsen. If you need medical attention, please seek medical attention as appropriate. The hospital will provide the services, and we don't want you to sit at home out of fear for utilization or fear for COVID in the event that you need those services. Please seek them as soon as possible.
I would also note that as it relates to elective surgery, one thing they have to keep in mind is that elective is a term that is often a little bit misleading. Elective includes things like transplants. And so I'm not sure how elective people would view things like transplants. But obviously it's a very intentional decision to cancel those procedures. And frankly, when you're starting to see those warning signs, it's a real concern. It's not just something you do because, it's just going to affect hospital profitability. There are real lives affected by cancellation of elective procedures. And therefore, I think it's just important that we, keep in mind that, when we're starting to see those signs, that's when we all should be very concerned now. but that really represents the tipping point when we're starting to do those, make those intentional decisions to cancel things like that.
Thank you, Mr. President. I apologize for going way over.
And every question you had was certainly on everybody's mind. So, Councilmember Friedson, please.
Thank you, Mr. President. I want to build off of the child care questions and concerns that Councilmember Albornoz raised. The first is, this is obviously disappointing. We all share in the disappointment that the state did not issue the waiver. I will say that relationships do matter. And this is one of the challenging circumstances that we have found, a clearly deteriorated relationship between the county executive and the governor, and the serious consequences that has on families and on our residents. And it's just a disappointing result. I hope that we can get a change, but I, like others, am not optimistic, unfortunately, about whether or not a strongly worded letter is going to impact that. I'm just curious, we're 13 days away from when this is going to go into effect. We had an executive order that caused a lot of confusion and disruption for families and providers already, which I'm glad we were finally able to clear up, but some of that damage was already done because of the false starts and the miscommunication that occurred. What are we doing right now to notify parents and providers of what is happening, what the options are, what the steps are going to be, and what the timing will be, so that this most important thing that is happening in their lives will be, so they have some knowledge of where things are? What are we doing to notify them?
Jennifer, do you want to talk about the communication with providers?
Sure. So Jennifer, a nice manager with Early Childhood Services. So we did a few things with the order and the informing the community that we had requested a waiver. We sent it to all 7 child care associations recognized in this county so that they could share with their members. We sent it through our e-blast. That's over 3,000 child care educators in our county. We also sent it to our commissions and councils that are targeting early childhood as their topic or their focus. So we spread it out into the community. We've used stakeholders and partners to inform so that they could also share that information. And most importantly, I also sent it to our regional office manager for the Office of Child Care so that they are informed. So now the next step is sharing with them that it was the waiver was rejected. And if the letter that was sent out is made public, we would also include that in any communications.
When will that happen?
Well, so I just saw the letter now to the superintendent and the governor. So if I can work on that this afternoon, I can do that.
Okay, it'd be helpful if you let us know what's being communicated, because I am concerned that the communication has not been what it needs to be and what it should be. So I hope that we can get ahead of that. I will say, like I said, the strongly worded letter, I'm not optimistic that it's not really how most decisions in state and county government get done. I mean, it's a public advocacy effort, but it's not really what moves the needle generally. And schools are going to have to either hire more people, which means they're going to have to charge parents more money at a time when they can least afford it. Students may be kicked out because they have to follow the guidelines, or providers will be forced to close, as the county executive in his own letter said is likely to happen. I mean, these are really serious, dire consequences. And I've got to say, from what we're hearing here, it feels very reactive and not very proactive in terms of where we're headed and what we're planning to do. I understand these are challenging circumstances. We all disagree with the state and the decision that's being made. I don't think it was the right decision. I don't think there's any disagreement here on this virtual dais about that. But hearing things now about we're going to put our heads together, we're thinking through our options. The letter was the first step in the process. The county executive now has to decide what he wants to do without any real plan B of what we're going to do besides a strongly worded letter and the attempt at this late hour to try to gin up public advocacy in order to pressure the governor. It just seems inadequate for the importance of this issue, for the seriousness that it has on families and on providers. And it's just not a very good response that we're able to provide for families and providers who reach out to us when they say, what now? What's going to happen? What's going to happen for my kids? What's going to happen for our organization? And the answer is, well, there's people in the county who are putting their heads together, and the county executive has sent a very strongly worded letter to the governor. It just doesn't feel like that is sufficient. So I hope we can get a plan. I hope that we can have something that we can move forward. Everybody here is willing and interested in working with you all to make that happen, but it has to be done yesterday. Thank you, Mr. President.
Thank you. Ms. Barnes, did you, please? And I saw your hand up, but you can also just let me know you want to speak. I mean, speak out, but please, Ms. Barnes.
Thank you so much. And Councilmember Friedson, I really do appreciate your comments. I just want to emphasize we have been meeting regularly now to continue to monitor what's happening in the child care situation, with a focus both on early childhood as well as the school-age child care. And one of the things that we have to do is really assess the providers that we know are open. As Jennifer mentioned, we're constantly in contact with them to find out what the immediate impact will be to the provider community, and that will inform the recommendations that we put forward. So I don't want you to think that we are not actively working on this, but for both your comments as well as Councilmember Albanon's, I want to assure you that we will come forward with some good recommendations that we hope will not only meet the needs of the providers, but the families too.
I appreciate that. I just hope we can take the analysis and turn it into action, because families are desperately waiting for it and providers are trying to figure out and struggling to understand what this means for their organizations. Thank you.
Councilmember Friedson, with the help of the council, that is what we have been doing for 8 months, and we will absolutely continue to do exactly that.
Thank you. Councilmember Rice.
So a lot's already been said. So let me just jump into a couple other things that haven't been. Dr. Gales, when it comes to travel, understanding that many children, including my daughter, will be coming home from college. What are recommendations that you have for families, those that are picking up their children, coming back into the area from another area, to try and, again, minimize the community spread that's out there? These are all important messages so many folks have, and just trying to understand what the best practices are for people in those types of situations.
Sure. It's an excellent and timely question. We're encouraging folks, particularly if you are traveling from somewhere else, to get tested before you leave that destination and get tested when you get to the destination where you're going. And it is also prudent to consider quarantining yourself as much as possible while you're awaiting those results. And so quarantining doesn't mean that you have to go necessarily stay off by yourself. That can be an option for some. It could mean when you are in a household around your relatives is, wearing a face covering and, minimizing your time around others and making sure that when you're observing those physical distancing principles. Those are just, again, a host of strategies that we would recommend folks to do while they travel and come into contact with other family members. But testing is the key component.
Thank you very much. And again, testing is available not only at our county sites, but also via private providers, and the multitude of availability in terms of rapid testing. Is there any difference between the efficacy of rapid testing that normally gives you the results in a day versus those that sometimes take between 3 and 5 days?
Well, the issue with the rapid testing technology is that there had been, concerns about, the confidence level in terms of, some false positives. And so, there are, in some spaces, the recommendation algorithm is that any, result that you get, you should follow that up with a confirmatory PCR test, particularly those for positive tests. The concerns with the rapid test are they are we feel pretty confident if a symptomatic person gets a rapid test and it comes back positive. The concern has been making sure they're really accurate for asymptomatic individuals. Because we don't want someone, to get a test, it comes back negative, and there's the sense of, oh, I don't have it, and then, subsequent testing reveals that they actually do.
Excellent. Thank you very much. And then my last question is just still regarding our school system. You heard about childcare, but obviously, as I filled out a questionnaire last night from Montgomery County Public Schools as a parent about what my preferences are when it comes to children possibly returning in January, understanding that the main months that the flu is actually at its most active is January and February. And that's when we're looking to actually send children back to school potentially, should the numbers and the metrics work out. What do you see as the practicality of that? And are there recommendations for families in terms of what we should all do for our children? And then I've got one last question about vaccination.
Well, I would say the practicality is MCPS has put out a very well thought out, comprehensive, algorithm and matrix to think through those decisions. I think one of the things that will potentially help facilitate that better is potentially having a vaccine available in terms of offering protections for those who are most vulnerable. Because, most of the actions that we're taking are, in a broad perspective, we're trying to keep everybody safe, but ultimately it's to keep numbers down as much as possible to protect those who would be most likely to have a severe outcome if they contracted. So, if we're talking about going back to school with decreased numbers in the presence of a dissemination strategy that has already started to distribute vaccines to the community, at least to the most vulnerable, I think that's a very different conversation. And, so the hope is that that's the conversation that we're having in January, even in the setting of flu season. That would, offer more optimism in terms of being able to successfully do that.
Excellent. And then my last question. Sorry, Dr. Stoddard.
Yeah. Sorry. I also note that the typically flu season is actually starting to by let's say the third week of January, it's actually started to go on its downhill slope, and so it's I think by mid-February, late February, we're typically. And I would also say we're already starting to see, and this is like I try and be optimistic where we can be optimistic. We're actually seeing a little bit lower of a flu season, a fair bit lower than a flu season so far, which means that some of the public health measures, as you might expect for COVID, are also playing a role in reducing influenza. And so that's not to, and so, the uptick that would normally occur around this time and, really mid-October through, say mid-November, we have not seen the incline that we would normally expect to see during this time of year. And so that does bode well that we will not see the height of the peak. It means we need to keep doing what we're doing in terms of, washing hands and face coverings and distancing, all those things. But it will have that collateral benefit during flu season as well. So.
Thank you. I just have one last question. It's really important about vaccination. So I had heard, so Dr. Gales, Dr. Stoddard, please correct me if I'm wrong, that the current studies for vaccinations did not include a cohort of children. And so where are we when it comes to vaccinations and children and returning to schools if we have a vaccine that hasn't been tested on them for side effects, effectiveness, whatever the case may be?
You are correct. So the two studies that have gone out have been on adult candidates. There will, based upon how, so the short answer is science will continue to study that and to conduct those tests based upon how the priority groups are laid out. Now, certainly any children who have severe illnesses and medical conditions who would fit the criteria of the early stages would likely receive some type of vaccine strategy and schedule that's tailored to them. But as it currently stands, pediatric distribution is scheduled for the third priority group. So that would allow for opportunities to conduct some more trials within that age group to have a better understanding of what those impacts might be.
I will also clarify one point. So while the initial results announced both by Pfizer and Moderna did not include tests in children, there are tests in children that are ongoing, and the results of those have just not been reported yet. I think Pfizer, for example, I think they started their trial in children, I want to say in the University of Cincinnati Hospital at the end of October. And so they're just lagged behind the adult tests, but they are doing some limited level. Obviously, and for good reason, we apply a lot more scrutiny to the trials that we do in children because, number one, because they're children, but also because they give some sort of strange results sometimes because, children's immune systems are developing and things like that. But I say that there are trials that are being done to test the efficacy of vaccines in children. We just don't know the results of those tests yet, and that's why they weren't included in the early comments.
Thank you very much, and thank you, Mr. President.
Thank you, and that's vital information. Vice President Hucker.
Thank you, Mr. President. There's a lot here, as usual. I agree with Councilmember Albornoz that the communication from the governor's office on this, to me, is it's incredibly bad and disjointed and disconnected from our response. It just continues to baffle me. I think it's easy for us to lose sight of that fact and of the state's responsibility, because in Montgomery County, we are so used to stepping into the void and doing for our residents what the state is charged with doing under the Maryland Constitution, whether it's providing an adequate and equitable education system or doing healthcare delivery or inspecting our nursing homes or providing a high quality childcare system. Those are all state responsibilities, but we have to do them in Montgomery County to backfill. I'm so used to, I agree with Councilmember Friedson that a strongly worded letter is an insufficient as a government relations strategy. We have the largest and the most powerful delegation in Annapolis and a very large and well-funded Office of Intergovernmental Relations. They're our lobbyists. They, I think, should both be engaged in this discussion of how to get the state to meet its responsibility. It's not just on the Montgomery County government, to be fair to everybody here. I can't think of any other governor in 20 years who did not have routine conversations with the county executives of the largest jurisdictions in Maryland, particularly so during every natural disaster and every public health emergency and every recession. I've never seen any governor be so disengaged from local leaders during those types of emergencies. For Governor Hogan to conduct only conference calls with the executives of the largest jurisdictions and to do so through staff, not personally, is just absolutely bizarre and is not serving us well. The governor, I know, likes to show that he's in charge. The way to do that is he should be having televised weekly briefings with his cabinet present for all the executives of the largest jurisdictions in Maryland, and going through in detail everything on their dashboard, everything they're doing to meet their responsibility to address this emergency, and taking questions from county executives as well as from the media. That's what ought to be happening, and it's not happening, and it certainly doesn't happen in conference calls through staff. I agree that the denial of the waiver is really unwise as well, and I absolutely agree the governor needs to provide more funding. $250 million was a start. It took way too long. We asked with the comptroller of Maryland, our chief fiscal officer, we asked for $500 million. We said that was needed statewide. It took months to get the $250 million, and there are hundreds of businesses that are now out of business because the state's response has been so parsimonious. Those state tax dollars that have been wisely put into the rainy day fund during an economic expansion by state legislators are not doing any good in a bank account in Annapolis. They need to be on the street, keeping our small businesses open and protecting our residents, but they're not. So I think we need to redouble our efforts through our government relations office and our delegation to get the governor to release more funding.
Can I answer your question about intergovernmental relations? They have been very involved in this process, and I know Melanie Wenger has already had conversations with several key legislators in both the House and the Senate this morning that are in leadership roles around this issue this morning. And I would also.
I'm not being critical. We make that part of these briefings.
Yes, and I would also note that Dr. Salmon even rejected an entreaty from the Senate president about a child care guidance. So it's not just he's not paying attention to us. He's not paying attention to County Executive Elrich. Yep. He's not responding in a positive way to other key political leaders in Maryland.
I know he's not. I've talked to many that feel the same way. I agree. And I'm glad certainly that Prince George's and Anne Arundel, followed our lead. And thank you, Dr. Gales and Stoddard, for pushing us to take, and saying and reassuring us that others would step up. But of course, this should be coming from the governor's mansion. This should not, Montgomery County should not be leading the public health response for the state of Maryland. It's not our job. It's his job. So, that's, I think incorporating briefings from our lobbyists, our elected lobbyists and our staff lobbyists in these briefings would be helpful, Rich. Can I just ask about nursing homes? I'm going to run out of time. They're particularly a state responsibility. The issue got a lot of attention in the beginning of the pandemic. It's gotten less attention recently. It is still a large percentage of our caseload and our deaths. And it's important to ensure that our state staff are working in a coordinated way, obviously with the county staff that, as I said, are backfilling. I noted that there was new guidance saying that visitors have to get tested and staff should avoid large gatherings and facilities should stockpile PPE. That's great. Can you comment on how that's being enforced and how we'll know whether any staff are avoiding large gatherings or not?
So that's a great question. So even though it has seemingly fallen off the radar in terms of the public attention, our team has continued to work with the nursing homes and assisted living facilities throughout, over the summer, related to implementing testing strategies, as well as trying to navigate the different guidance that's come from the state. Our technical assistance team that work, or go teams, ready to, however we described them before or named them, have continued that process and have there's certain kind of triggers that the case numbers trigger in terms of how frequently the state comes in and visits and provides that additional support. There also are triggers set up in that guidance to determine how frequently there should be testing in the facilities based upon the jurisdiction test positivity, those kind of things. In the last week, we have had conversations to discuss where we may need to actually create tougher restrictions around that. And those, some of the areas that you mentioned are some of the things that we're thinking about in terms of tightening things up more so than the state has so far.
Mr. President, with your permission, I'd love to schedule a briefing with involving the state's public health team could be here as well. We shouldn't just rely on the heroic work of Drs. Gales and Stoddard. I'd love to hear what the state is doing to meet their responsibility to protect our nursing home residents and their families.
Thank you. It won't actually be my permission. I believe it'll be someone else's permission coming up very soon. So, but I think it's an extremely good idea. Councilmember Glaze.
Thank you very much, Mr. President. I associate myself with all the questions and comments of all of my colleagues. And following up on some of the conversation that Councilmember Navarro engaged in regarding communication, I know she and I have been beating this drum that we need to do a better job of informing our residents of the state of this pandemic and what it means locally. And I have had a few conversations with various staff members at the council side, at the executive side, and everybody, including all my colleagues, everyone on this call, everyone realizes that we got to step it up and be very direct in our communication. And with that, I just want to share real quickly, if the capacity exists, on my end, I'm sharing right now the 7-day average for the confirmed cases in Montgomery County, the chart that is on our dashboard. And it doesn't take any words or explanation to show what's happening. It is clear as day that the second wave is here. And we need to continue sharing this information, or I take that back. We don't have to continue. We need to proactively and vigorously share this information with people. We know that a picture's worth 1,000 words, and this is the image that we need to convey. And we have more data that doesn't lie, and it shows how severe this situation is. And that one chart with the 7-day rolling average is the leading indicator. It is the canary in the coal mine for which all the other data will trend poorly, from hospital utilization to the other data as well. And so we need to just really step it up so that all of our residents know, not only our residents here, but the residents in the region. And there are a number of ways that we can do that. So we got to redouble our efforts there. Switching gears just a little bit, a number of constituents have contacted me in the last week, and I'm hoping that in this public conversation, we can receive a little more clarity, or they can receive a little more clarity. The executive order that we agreed to recently changed some of the requirements clearly for restaurants and fitness centers, reducing the capacity from 50% down to 25%. And with the fitness centers in particularly, there's a 25% capacity or one person per 200 square feet, whichever is lower. Dr. Gales, Dr. Stoddart, a number of people in the swimming and competitive swimming and diving communities have been reaching out to me, curious as to why that ratio, the 25%, is different for our aquatic centers. And as I understand it, the aquatic facilities are limited to 25 people per facility, which is not the same as the fitness centers. So can you just share in public, which will save us all a lot of emails and phone calls, why the aquatic center metric is as it is?
Yeah, it was not our intent to actually have it be interpreted the way it's been interpreted, meaning, so we're gonna add some clarification. As the county executive alluded to last night, there are some tweaks to the executive order that will be coming over to council this week around, predominantly around gatherings and face coverings, but we will add some clarifying language to the swimming pool issue as well. It was not our direct intent, and I talked to Dr. Yells and Ms. Kinch from the county attorney's office to limit to 25 indoor swimming. I just feel the need to say very clearly at this point, though, that if we continue at the numbers that we're seeing over the last several days, I think it's extremely likely that we will be discussing cancellation or closure of those activities in the near term and not the long term. And I just want just to manage expectations, while we're going to add this clarification to allow, I think, to recognize that it wasn't an intent to say 25 limited. And we have talked to our rec director, Robin Riley, as well about this as well in terms of how the county aquatic centers are interpreting it, just to get that clarification out there. But I feel the need to say, people should just recognize that if our cases stay where they're at, changes are coming, and they're going to be more restrictive than what we're correcting it to.
I appreciate the candor and the recognition of the reality. And so, I started my comments by talking about the data, looking at the charts, and then, appreciate your thoughts about how that will impact all of the public policy moving forward, but also appreciate you saying that the interpretation of that regulation wasn't executed as expected. So thank you very much. I yield back.